welcome back to the show. You're listening to Houston Real Estate Radio. We've had great guests on for you today. We're having so much fun down here at the Texas Home and Garden Show. It's their 20th annual show. Lots of fun. So many vendors down here. You know, if you're trying to decide between selling your home and renovating your home, then this is the place to be, because the realtors from Register Real Estate Advisors are out here who can tell you what the value of your home is, and then you can compare it to the cost you would put in from the estimates that you get at the show, whether you're putting in granite, redoing your bathrooms, you know, redoing a kitchen, whatever your remodel situation is, you can take that and compare it. So it's a great place to be today. We're going to be here until 5 p.m. down here at the NRG Center at the Texas Home and Garden Show. This segment, we're going to be talking about insurance. I've got my friend Tim Oneill here. You've heard him before on the show because he does sponsor the show. So you can get to his website directly from our website. Just hit the ad for Tim Oneill over at State Farm, and you can get directly to his website, call him, and get a free quote for all kinds of insurance. Today we're going to be talking a little bit about health insurance, but he does auto, home, life, all kinds of insurance, every kind of insurance, business, whatever you need. Tim's your man. Welcome to the show, Tim.
Thank you. Well, it's a pleasure to be back.
So let's talk a little bit about health insurance. We haven't really talked about that before. We've talked about life insurance, mortgage insurance for life insurance with your mortgage. We talked about car insurance. We talked about homeowners insurance. We talked about all kinds of insurance, but we never really talked about health insurance.
I knew this day would come when you would get me on the spot and we would have to go there. But yes, it's timely, actually.
Yeah.
So it's a good time.
Why is it timely?
Well, under the Affordable Care Act, as some of us may know, November 1st begins the open enrollment period for anyone who hasn't already complied with the law and purchased health insurance, or someone who wants to do some comparison shopping or for whatever reason. Open enrollment is November, December, and January. So
November 1st through January 31st.
That's right. That's the period during which you can apply for health insurance from whichever participating carrier on the exchange or off the exchange, and it's guaranteed acceptance. You will be able to buy a policy. And
doesn't matter about pre-existing conditions anymore.
No, all of that medical underwriting, pre-existing conditions, even height and weight, medications.
Don't have to go through a medical screening?
No, none of those underwriting factors are in play anymore. The only underwriting factor, I think I can say the only, is whether or not you use tobacco. So there are still different rates for smokers and chewers and dippers, because, you know, we learned that in the business. You ask people if they smoke, and they will honestly tell you, no, I don't smoke, and then they come back and they fail the nicotine screening.
Oh, yeah.
Well, you didn't.
So it really should be, do you use nicotine?
Yeah, so the question now, the properly worded question now is, have you used nicotine in any form, including the patch? Because there are people who will flunk it because of the patch. They'll say, I don't smoke, I don't chew, and I don't dip.
But they still use the patch.
And they have the patches, so they still flunk the nicotine screen. So there's still a different
So they do a test for that.
They test for nicotine. And so there are different rates for whether or not you use tobacco or nicotine.
All right. So it's really great that they threw out the pre-existing conditions. You've got some new rules with healthcare. Are you able to is it better to call all these individual companies and get quotes, or is it better to go online, or is it better to have the insurance person just find out what your needs are and go out and shop it for you? Well, what's the way? What do we do? What do we do?
It's one of these things where, do you want to get your health insurance plan from the lowest bidder? You know,
you want the best coverage when it comes to healthcare. You only get one life.
There's a question of service and responsiveness and who do you call, and, you know, sometimes it has to be go to the lowest bidder in some things in life, and some things it's appropriate. But I would suggest that it's not necessarily appropriate to get your health insurance from the lowest bidder, because you want to have access to questions and service and follow-up. And
you got to compare the plans, because you've got your pharmacy stuff, you've got your mental health stuff, you've got your normal health care stuff, you've got what are your co-pays going to be. I mean, there's so many things to compare. How does someone, you know, like me who doesn't know much about insurance, how do I compare those policies?
Some of it's been taken out of it for us because the Affordable Care Act mandated the coverage across all policies. So there's not a lot of competition with regard to the benefits. The benefits are mandated and they have to be in there, or the policy can't be offered on the exchange. And what that really means is it doesn't comply with the law, so having it, you'll still be in violation. So if you buy a compliant policy that provides the required benefits, then you'll be fine, and those are pretty well standardized across all companies offering the policy. So you don't really have to shop too much in terms of benefits. But as you mentioned, there's some competition with regard to deductibles and the level of coverage that you're going to get. But they name them metals. There's the bronze, the silver, the gold, and the platinum plans, and those are highly standardized, so that you don't have to really look too deeply beyond.
Is there a website to go to for that, or people just call you and you send them the quotes? How does that work?
It's Healthcare.gov for someone who wants to go by him or herself, and you can get linked to different places. But you can go to. There's numbers of us in the insurance business who have gone through a fair number of hours of training and registration to get familiar with all the policies and products and procedures and the do's and don'ts and what you can and can't do, and then to get registered with the Centers for Medicare and Medicaid.
Well, there have been so many changes. I can't imagine why anyone would want to go to just a website and pick it. It's kind of like when you buy a house. You don't want to just go to Zillow. I mean, Zillow is one of a million tools. It's not the tool. You don't go to Zillow when you want to sell your house. You go there when you're playing, and you just want to see what's going on in the neighborhood. You don't go there to sell your house. You go to your realtor when you want to sell your house. So insurance is kind of the same way. I wouldn't go to a website to figure out which policy. I'm going to call you, obviously.
I wouldn't, but it's a highly segmented market, and we have, like in any market, there are people who are self-directed, and they just want to click and pay and be done, and they don't seek advice or counsel or expertise. That market segment really can do well.
I guess if you're in really good health and you're really young, you can do that.
If you're going on there, if you just click, pick a plan, put in your zip code, basically your age, your zip code, do you use tobacco or don't you, and then bang, up will come all of the choices, and you literally can click your mouse and be done with this in 5 minutes. If you're that type of shopper, and some people are, and more power to them. There's nothing wrong with it. But
so
some
when
people
you
want
shop policies, you go to the different companies and get the different quotes and present them? Is that how you do it?
Different agents and agencies are set up differently. I only represent the Blues. I only sell Blue Cross and Blue Shield through my practice.
Okay.
But there are a number of other, in any jurisdiction.
Blue Cross and Blue Shield is good.
Yeah, it's reliable, and they're not going
anywhere.
Been
around a long time.
So in different jurisdictions, there are going to be different carriers participating on the marketplace.
Okay.
And when you go to the healthcare marketplace, you'll see which companies are offering policies in your area, basically your zip code, and you take it from there. And so you literally can click and pay and be done on that website if that's the way you prefer to buy. But
okay, I want to talk next about something that I think is very cool, the health savings account. The reason I think this is so cool is because I used to work for the school district, used to be a school teacher, and so when you work for a big company or you work for the city or the school district, they offer this, and everybody signs up for it when they join, because you can put money in there and then go, it's tax-free money, and then you go spend it on your eyeglasses and your contacts and things like that. Dental stuff and all. So I've loved it. Well, then all these years I've been owning my own business as a realtor, and now owning a brokerage, and so I didn't think that was available to me anymore. It's still available.
It's definitely available.
It's available to everybody.
It is.
I didn't know that.
Medical savings accounts.
See, I only know about real estate. I don't know about anything else.
The only kicker is it's only compatible with what's considered to be a high deductible health plan.
Okay.
So in terms of the exchange, I want to say that it's the bronze plan that qualifies for high deductible, and I think that silver and gold do not. So if you have one of those plans, because the deductible is relatively low, you wouldn't qualify for a medical savings account. And so people who had frequent use of medical services and knew that they had upcoming bills and whatever would probably go for silver and gold plans, because they'd have more access and lower deductibles, whereas a more medically fortunate family who very rarely got sick and was really just looking for catastrophic level care, they would go bronze and would be able to qualify for a medical savings account. And you can save, every year you can save the amount of your deductible. So on a typical family policy, you could see, a $5,000 or $6,000 annual policy deductible. And if you have a qualifying health plan and a Medicare medical savings account together, you're allowed to save that $6,000 deductible in your account.
That's a great benefit.
Above the line, it comes and it's tax-free. So it's tax-free money that goes in there, and as long as you spend it on qualifying medical expenses, it's never taxed.
Yeah.
And you don't run into that use it or lose it. In the early days of medical savings accounts, the medical benefit accounts, you had to exhaust the funds every year. So in the end, in November and December, people were looking for a way to get rid of that money on something.
Yeah.
But you don't have that in a medical savings account. You can let that money roll over and accumulate, and you can resave your deductible every year and stack it up, and you have no obligation to actually draw money from it.
That's fantastic.
And in the end, you actually can convert that to retirement savings. There's a process and a procedure, but you don't ever face that use it or lose it headache.
Wow, Wow,
we had
that's great.
back in the day. So
Yeah.
it's much improved.
So if consumers out there are listening and they're like me and they need this, how do they get in touch with you?
Well, as you mentioned, you can go to your website and click through.
HoustonRealEstateRadio.com.
Yep,
Click on Tim Oneill, State Farm.
That's the way to do it.
Okay. And if they are, if they can also go to HRERinsurance.com.
Yes,
Takes you right to your
my
website.
favorite website, HRERinsurance.com.
All right, very good. Well, thanks for listening to Houston Real Estate Radio. We appreciate you listening. You can find all the videos of today's show at HoustonRealEstateRadio.com.
People often find themselves in need of storage and moving, but don't want the hassle and stress. Sound familiar? Well, at Zippy Shell, we make storage and moving easy. Zippy Shell will deliver a storage container to your home or business. You load it at your leisure, and we'll take it to one of our safe, convenient storage facilities, or ship it to your final destination. We treat your stuff like it's our stuff, because we understand you're not just giving us your belongings, you're giving us your trust. Zippy Shell. Storage and moving that makes life simple.